Hi everyone, and welcome to our next session. I'm Atia Kamal. I'm a health psychologist and senior lecturer at Birmingham City University. And our next session is going to explore the topic of what Black health means to us, an African perspective. And it's my great pleasure to introduce Angela Kumar and Dr. Basiru Guy. So a little bit about each of them. Angela is currently conducting her PhD at Birmingham City University. Her research aims to improve culturally sensitive mental health promotion among Black African and Afro-Caribbean communities in Birmingham. Using a model called appreciative inquiry, Angela will explore the subject of resilience within the Black community in relation to culture and mental health to encourage service user input in mental health service design and delivery. Of course, the session we had just before this one highlights why that is so important. Angela also has a Master of Science in Abnormal and Clinical Psychology from Swansea University and has also worked in a dementia care home, palliative care ward in the UK, and worked as a community mental health support worker and juvenile rehabilitation officer in her home country in Ghana. In her current role, she supports various projects run by the United Community Activity Network. This is a Birmingham-based charity within her capacity as a mental health professional. She provides advice, online resources, delivers digital mental health and wellbeing related programs, and collaborates with various voluntary sector organisations in Black African and Caribbean communities in Birmingham. Dr. Basiru Guy was the spark for the event itself. So Basiru reached out to the team in the States and initiated, created the spark that has resulted in today's event with, of course, lots and lots of work from many partners to make it happen. But Basiru graduated from the Faculty of Medicine at the International University of Africa. He has more than a decade of experience of managing patients with complex medical conditions and has worked as a doctor at the Sudan Federal Ministry of Health, after which he returned to the Gambia, where he led a medical ward in the country's only teaching hospital and supported day-to-day clinical management of people living with HIV and AIDS, but also supported junior doctors in their personal and professional development. He later joined AfricMed Clinical Services, where he went from being a medical officer to principal medical officer, and later went on to become the clinic's deputy chief executive officer. He's very passionate about health inequalities, and he has also attained a Master's of Science in Public Health from Birmingham City University, and is currently doing a PhD in the area of health promotion for Black people. So welcome, Angela and Basiru. So
thank you,
I'm going to ask, thank you. I'm going to ask you a series of questions, and it'll be lovely to get each of your thoughts on it. So the first is, what does Black health matter to you?
Okay. So I'll go first. In answering the question, I asked a couple of my friends what Black health meant to them, and I'm going to paraphrase their answers, but two of them talked about it being about total well-being or total wholeness of mind, of body, and of soul. And I believe so because our faith and our religion is very important in regards to our health as Africans. They also talked about a Black person in their state of and time, having to deal with all the marginalization that we've had to deal with, being able to bounce back from that, but how that also has a negative impact on our health. So it's both sides of the coin, the fact that health means holistic well-being, psychologically, physically, mentally, emotionally, socially, but also the other side of the coin that talks about health being a necessity just to be able to survive. So yeah, that's my opinion of what Black health means to me.
Yeah, for me, I think as a physician, when I hear the word health, the first thing that comes to mind is physical health. But then to start this topic, I would refer to the WHO definition of health, which is quite famous within the medical fraternity. And it states, WHO states that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And why am I bringing in this definition to this question is that I want to focus more on the social well-being of health itself, because I think that is one part that is often very much forgotten about, and especially in the Black community, you can't really say focus on the physical well-being of Black people and forget about the other aspect, because for the Black people, the meaning of health is tend to be a bit different, and it's simply a way that it's a way of moving on. I mean, for them, for most Black people, because of the conditions they found themselves in, being healthy simply means being able to move on and carry on the daily necessities of life. And I think that's where my clinical experience actually lay more on in terms of health than rather the complete definition of health.
Okay, so for both of you, it is more than just a biological disease process, but those broader influences are varied and incorporate those cultural elements that are important. My second question is, what are the challenges affecting people from Black communities in terms of their health, and how are these challenges affecting access to healthcare?
Okay. I'll let Dr. Guy go first on this one.
Well, yeah, if you do, then I would actually make it very brief. And in that, I would say, if we talk about the challenges of affecting Black people's health, I would rather refer to the social aspects, which is something I would call the social determinants of health, which are the non-medical factors that influence health outcome. And these conditions are the ones in which people are born, the ones in which people grow, people live, age, and in fact, the wider sets of forces and systems that shape the condition of daily life. And this is important because basically, as people try to be healthy, there are things that they could basically change that is at their reach to stay healthy, but there are those which actually is within their environment that they do not have the ability to take control over. And I think those are the ones that actually are quite important when we as health professionals come in to bring in solution to some of the health challenges that actually affect Black people or the community at large. And in that, I would refer specifically to deprivation. Being an African and having worked in Africa, deprivation is really a very common word. It's actually part of the daily life, experience. Deprivation in terms of hospital access, general health access. But then this deprivation is not, coming to the UK, I found that deprivation is not just confined, in terms of health, it's not just confined to Africa. And there is basically evidence that there is growing health inequality in the United Kingdom, for example, going by the evidence from the Marmot report. And we all know that deprivation affects your life expectancy. The higher your deprivation index is, the higher your life expectancy is, the lower your actually life expectancy is, and vice versa. And this basically points to some of the reasons why we find Black people being disproportionately affected more by certain medical conditions as compared to the white community, for example. And this, I would say that there is evidence, of course, showing that Black people and other ethnic minorities in the UK are more likely to live in deprived communities, which, of course, would make them more prone to shorter life expectancy as compared to the white community. So the challenges are really multiple, and in a general nutshell, this is basically going back to the social determinants of health.
Okay. I'll basically relate what I'm going to say to what Dr. Guy has already spoken about, but in regards to Maslow's theory of needs, and as Black people, as African people, Afro-Caribbean, and wherever you're Black, the mentality is that you get up, you fall down, you get up, and you keep moving, okay? So we don't stop. We don't know how to cater to our psychological needs. On Maslow's theory of needs, he talks about being able to deal with our physiological needs, our safety needs, belongingness, and love needs. But as Dr. Guy has already spoken about the socioeconomic context, this there's this narrative that, deal with what you have to eat, people are more concerned about finding what to eat, finding, food for their family, finding warmth, just getting up and going to work and making money and being able to cater for basic life needs. And then we don't have the opportunity to deal with other problems, such as mental health problems, for instance, because they are not put on the same level of, if I'm not able to get out of bed because I have a mental health issue, I will not be able to work. And it's sort of like they're put in the background. So that ties a lot to the fact that because of socioeconomic factors, we are unable, or it's not a priority to cater to these other needs, to these other healthcare needs. Also, in regards to that, I talk about access being an issue because of resilience narratives. And I talk about this from a mental health perspective because we are constantly being told that you're a strong Black person. In one of the previous seminars, Dr. Jenny Douglas was saying that we know of the narrative that Black don't crack, but Black do crack. And we need to acknowledge that we do crack. We don't talk about those things enough. So simply not acknowledging that there can be a problem with that, there can be a problem with our mental health and our physical well-being does not guarantee that we will go and seek help when we have to find it. I mean, we have to wait till my father will say your ear is falling off before we actually seek medical help. And that's also, ties right back to the socioeconomic factors. So as Dr. Guy has said, it's a multi-tiered issue. I want to go into a lot of detail about how the system in Africa has usually failed us. Dr. Guy is a medical professional and he knows that the facilities are basically not available in the first place. And if you have to access them, you need to have money to be able to access them. But I feel also that people are unaware of the services that are available, for instance, and not being aware of the services affects access. Take, for instance, when I was working in Ghana, a lot of people did not know where to access help for addiction. If they had an alcohol addiction, if they had a drug addiction, they did not know where to find that kind of help, how to get into rehab. Even if they had to get into rehab, it was really expensive. But basically, people did not know, there's not as much information going out. And there are a lot of organizations in Ghana outside of governmental institutions that are providing help and support, but people are just unaware of them. And that really, really hampers access to healthcare services, whether mental health or physical healthcare. So yeah, I think those would be my points. Yeah.
So you've both mentioned multiple complex factors that are interacting. So what then could be done to improve access to healthcare and healthcare services?
Okay, I will start, because I'm going to be, I'm talking from a mental health perspective. I'll start by talking about destigmatization and being aware that having a mental health issue does not mean that you're mad or that you're crazy. I think that's the popular narrative that you're either really well or you're really sick. And we don't know how to find a balance between both of them, that you can be both things at the same time. There are some days when you can be up and there are some days when you can be down. And we need to be able to acknowledge that. Being aware of that, we need to know that having a mental health issue or having a physical health issue, whether it's diabetes or cancer, or if you're noticing changes in your body, it's not a time to start to think about the stigmatization, or it's not time to start talking about the discriminatory aspects of whatever illness you are dealing with, because that is the problem. There's just so much discrimination. And unfortunately, some of it comes of over-reliance on faith or religion. And I'm religious, or I have faith, and I believe that it's important to seek help. But my favorite quote is, you can give it to God, but still talk to your therapist or still talk to your doctor. It's really, really important to be able to bring that balance into conversations about health and well-being, and allow people to know that the fact that you are talking to a doctor about a sensation that you are having in your back or in your breast, or you are simply not feeling well, is not something to be ashamed of. You can still have a conversation about it. It's really important. Also, because I've already talked about faith and religion, faith groups need to step up a lot, because Basiri was saying before that you can't take religion off an African man's chest, okay? It's part and parcel of us, and we need to be able to identify these things when we're talking about cultural sensitivity. Because if you take faith out of access to healthcare, you leave the Black man in limbo. What am I supposed to do if my faith is not there? And I don't trust the system very much, so I don't want to access the help. Somebody went to the hospital and died, so I'd rather stay home and pray and I'll be fine. But we need to be able to find a balance, and that will require that faith organizations, whether it's mosques or churches or gurdwaras, whatever it is, whatever belief system you have, faith institutions must be able to contribute a lot to healthcare, have healthcare conversations, because if you hear your pastor or your imam talking about the fact that he went to a hospital because this was happening to him, you'll be more likely to understand that, oh, okay, this religious leader actually also accesses healthcare services. So there's no problem with me accessing these services as well. Those are very important factors. I'll hand over to Dr. Guy now.
Well, yeah, that's very elaborated, and thank you for that. But I would, picking up from two important points that you raised before actually moving on. You mentioned faith and stigmatization, and I would just give an example of how important faith is when it comes to improving healthcare and healthcare access for Black people. As I said earlier on during our informal discussion, I mean, you can't really take out faith from the Black person. It's part of actually what keeps Black people generally going. And even when there is no hope, there's always faith. And some of the interventions that we do actually introduce to improve Black people's health, sometimes we tend not to actually incorporate faith or the beliefs of actually these Black people, and then rather instead it ends into low uptake or even the failure of the entire intervention. And in this, I would just give an example of a study finding that actually revealed that when it comes to smoking, for example, we do know that the evidence suggesting that smoking is very strongly linked to cancers, especially lung cancer. And when it comes to some of the Black people, a community among the Black people, smoking, fine, but marijuana, for example, or cannabis, smoking cannabis is basically ritual, for example, for some of the Black community members. And coming, and even though we all know that, I mean, so most of the cannabis nowadays is mixed with tobacco, which makes it even more harmful. So to me, I think it's not just about telling people, for example, stop smoking, smoking is harmful to you, but rather understand why people smoke and then involve them in basically devising a mechanism that would stop them from smoking, rather than actually playing that paternal role in actually implementing the intervention. And the stigmatization, sometimes we do stigmatize unknowingly, and this is now what is more common. I will give an example of last year when the pandemic was at its peak and people really didn't know what was happening. There was no vaccine. I mean, there were prospects that, okay, we would develop a vaccine. And that was a very crucial moment to gain trust. If at all vaccine comes, what next? And how do we make sure that everyone comes on board and take the jab? Here we were back in April 2020, when two of our colleagues in the medical fraternity had a television show that actually, some two French doctors talked about vaccine trials in Africa. We all do know that there are lots of trials going on around the world and the like, but the way that was handled and even the aftermath, how the world responded, I think is, in my opinion, contribute to the vaccine mistrust that is going on in Africa. Rather, we have a lot of people right now who do not really believe that the vaccine is ideal for them in Africa. If you follow the social media conversation that the young people are having, you'll be amazed. And that these conversations are happening in the 21st century right now. So to me, I think going back to the topic, culturally sensitive intervention is a must when it comes to Black people. Of course, across the board, among all races, but Black people specifically. And reasons being because of the very dark history that Black people have actually experienced in the past, which diminish the trust that Black people generally have for the system and whatever intervention comes. So I think every intervention should take into consideration the culture and the way of life generally of Black people, and then mesh these actually values that Africans do hold on to and are very, very much, when I say African, I mean Black people generally, do hold on to and feel they are so important should be meshed into this intervention. And it should not just be an intervention that is an umbrella intervention for everyone. For example, the NHS is doing a wonderful job. It provides healthcare for everyone. But to me, that is not just enough. There should be interventions tailored and designed with Black people. It should be tailored to Black people's need and designed to fit the needs of Black people and with the Black people themselves, rather than just bringing in the intervention and say, oh, this is what we think is fits best for you. I will give you an example of an intervention that was done in Southern Sudan, for example. Sanitation, there was an outbreak of cholera some couple of years ago. Then I was a medical student. And one of the things that was done was they found that, oh, people who didn't have toilets, they didn't have pit latrines. They went dug a lot of pit latrines. When they went back to assess the intervention, they found that people were not actually using these pit latrines. They were actually doing it next to the hole. They were not putting it into the pit. So here, they did not, the failure, why did this intervention fail? Because the ones who went in to implement this intervention did not consider the understanding, the culture of these people who actually needed this intervention. So therefore, it was a total waste. And I would give an example of an intervention in Gambia, for example. When it comes, we all know recently there's been an outcry of mothers dying during childbirth or after childbirth, which we generally call maternal mortality. And I commend a hospital in Gambia called Bundu Maternal Hospital. This is a hospital that is, one, situated in a relatively densely populated area, two, in a very deprived community, and three, it's a government hospital. And the idea is that in Gambia, and of course many African countries, private hospitals tend to do better. And this hospital, realizing that mothers were dying because of one of the two most common reasons why mothers die, which is bleeding. One of them is bleeding actually during or after childbirth. So this hospital realized that this was something that was killing the mothers more than anything else, and they decided to come up with a solution. And the solution was blood transfusion everywhere across the world. And the culture in Gambia and many parts of Africa is, when it comes to women's health, it's basically dealt with by women. You would see that actually, you won't be surprised to see a mother going to the hospital to give birth and would not go with men or the husband, would rather go with her mother or the in-laws, some old people. And these are people who can't donate. And we don't have the luxury in Africa where you have blood banks available. You can actually use blood as you, when and as you wish. So one thing that these people did in this hospital was to invite the fathers, the males. They actually brought in what they call a male clinic, where they taught them in a way that actually preserved their dignity and make them understand the need to be supported. Because for the general men, generally men think that in Africa, think that actually supporting your wife is giving them the money to the hospital, providing taxi, and the financial bits. But it was more than that. And to make them understand this, it wasn't enough to just go to the radio stations and the televisions or fly banners and the like. But then they needed to be told in a language that they could understand. And the outcome of this intervention was really, really, really amazing. And this is something that shows that showing people that they are part of the solution rather than bringing the solution to them is really something that can actually be very, very useful.
Yep. So you've both highlighted some really concrete examples here. You know, the role of understanding the role of faith, gender, the unintended and knowing consequences of stigmatization, and you've offered, both of you have provided some insight into how we improve cultural sensitivity. And so I just want to unpick that a little bit more and just, you know, are there any other ways that we can improve cultural sensitivity in our delivery of health education specifically in the Black community? And you've said it's working with the community, you know, co-creating solutions, but, you know, I just wonder if there's anything more that you would like to add to that.
Yeah, what I like to add to that is that we should adopt more salutogenic approaches. And by salutogenic, I mean what actually makes people healthy, because with the research I've come across, when it starts to talk about Black mental health, we only talk about the negatives and the discrimination and the stigma. We don't talk about what actually works within the community. And we don't talk about how our culture and our faith and our arts and our music and our sports and our social connectedness actually facilitates our health and well-being. I mean, that's not to say that we shouldn't take notice of the things that are going wrong in the community, still important, but we should have more conversations surrounding what actually works. And when we approach conversations with, okay, this is what actually works. The fact that I have a faith actually supports my mental health or well-being, or my family supports my mental health or well-being. We are more aware of what works, and we are more aware of applying those strengths to the weaknesses that already exist, so that we are not constantly being bashed that things aren't working. Because when you constantly tell somebody that this is not working, you defeat their purpose. But when you come up with a more salutogenic approach and say, oh, this is what is working, it's amazing that this is working, but there's also this problem. How do we fix this problem using the strengths that we've already identified, or the resources that we've already identified? And I believe that this is the way to go when we have to be culturally sensitive in delivering healthcare services to the Black community.
Yeah, and in addition, I would just actually say one important word would be the humanistic approach, and seeing basically the Black community as a whole, as actually, as I said earlier on, as a community that basically is different, but still part of the general community, and it has its own problems, and the solutions could basically differ in a way or the other. And taking into consideration that there are some good things that actually, as Angela is saying, there are a lot of good things that actually are going on within the Black community that could be used and built upon, which would improve the health of of the people generally. And rather than just concentrating on what we feel could work for them, I mean the Black people. So bringing the Black people to be part of the solution, I think, is something that I would reiterate more and more and more.
Lovely, that's brilliant. So the positive framing to really empower communities, and when you show what works once, it does increase confidence to then see the change and believe that further good things can happen. I think that's really important. Change that narrative, but at the same time, very honestly address the challenges that arise. So we just have we're on to our sort of last minute or so. So just any final comments or thoughts that you would like to share?
I'll still go with my favorite quote. You can give it to God or give it to whatever faith or thing you believe in, but still talk to your doctor or your therapist. Be aware of who you are, your bodily sensations, seek help early. And I'm going to borrow Janice Lewis's quote that says, if it hurts, stop, go and sort it out. It's really important.
Thank you.
Yeah, and actually, to end, I would refer to my favorite health promotion model, the BT's health model of health promotion, which actually, my favorite part is the community aspect of it. And here I would say that personal counseling approach and community development approach are very, very vital. And they're often very much forgotten. As physicians and as professionals, we tend to basically feel that actually we need to bring the solution to the people in need. And sometimes we forget how much actually we could learn ourselves when dealing with them in that community development approach. So I would reiterate community development approach in every intervention that we aim to do with the Black community, and not just confined to the Black community and to all other ethnic minority communities within the UK or anywhere else in the world.
That's wonderful. Thank you to both of you, and for everyone else, we hope you enjoyed the session.
Thank you so much, Atia.
Thank you so much, Atia, and thank you very much, everyone, for your time.
Yeah.